It's been said many times in medicine that you are what you eat or you are what you absorb. And so this video segment is going to talk about Crohn's disease. Crohn's disease affects about 1.6 million people in the United States and is frequently confused with ulcerative colitis. So they're both inflammatory bowel diseases, but ulcerative colitis typically happens in a specific part of the colon and it only affects really one layer of the GI system. Crohn's disease affects multiple layers through the GI system and can happen anywhere, although the most common place is at the juncture of the small intestine and the large intestine. Now, the symptoms of Crohn's disease can be all over the place. The disease is an active part of ulcerative colitis. You can have diarrhea, you can have constipation, you can have a partially obstructed bowel or a completely obstructed bowel. You can have blood. You can have blood in the bowel movements. You can have all the complications associated with trying to get it out of the body, which is the hemorrhoids, the anal fissures, and things like that. And it can really affect other conditions or other parts of your body, such as your skin, your eyes, your joints. And essentially, if you're not able to get nutrients into your body system, then what happens is nothing seems to work. So it can be a risk factor for basically all other signs and symptoms related to chronic disease. The causes of ulcerative colitis, well, it's a defective immune system, either from a food sensitivity where your body just does not like something, it creates an inflammatory process, and then you get red and irritated GI systems, you get multiple layer involvement and ulcers and everything through those different layers, and then you have leaky gut syndrome. It can be frequently caused by a bacteria, a virus, a fungus. It can be just defective immune system where you get bad DNA from your mom and bad DNA from your dad. You can have a family history, and those are one of the most challenging cases to treat when it's bad DNA, but I think it's really important to make sure that it's not triggered by some type of infection, either a chronic viral infection, Epstein-Barr, it can be a portion of the human herpes simplex, it can be cytomegalovirus, it could be a chronic bacterial infection. I see a lot of Lyme's disease involvement in Crohn's disease, but it's more likely that it's associated with a food allergy. You're putting something into your system that your body doesn't like. It could be a food dye. And then frequently with ulcerative colitis, we get what's called spreading phenomena. Now, spreading phenomenon happens in irritable bowel disease conditions where all of a sudden your body doesn't like strawberries. And nothing against strawberries, it's just an example. But then it's strawberries and tomatoes. And then it's strawberries, tomatoes, and pasta. And then it's strawberries, tomato, pasta, and fruits. And what happens is it goes like this and bigger, bigger, bigger. I had a patient come in the other day that it started off with just one food sensitivity, and now they're basically limited to rice and boiled chicken. And what happens is your immune system gets revved up and up, it develops a hypersensitivity, and then the littlest thing seems to irritate it. And I see a lot of problems with seeds. When people are eating nuts and stuff like that, it really seems to bother ulcerative colitis. Now, the treatments in the traditional medical sense for ulcerative colitis is some type of steroid therapy to knock down the inflammation. And my concern with that is, what about all the inadvertent or side effects for the corticosteroid therapy of blood sugar problems, osteoporosis, slow wound healing? And so if that's the only option available, maybe that's the only thing that you can do. But frequently we throw the baby out with the bathwater. And what that means is we'll just immediately go into that session before we try any type of natural or lifestyle modifications. Another frequently common prescribed thing for Crohn's disease is some type of immunomodulator therapy, which knocks down a portion of the immune system. If there was some type of trigger that was bacterial or virus or fungal, and the immune system isn't working correctly, and then we kill part of it with the medication approach, it just is a bad situation for things later on down the road. And so I wanted to talk about some of the natural treatments for Crohn's disease that you may not be aware of that are really, really effective. The diagnosis for ulcerative colitis, your doctor may decide to do some blood tests for Crohn's disease. The most common one that they're looking for is any type of internal bleeding. So they'll typically do a blood cell count test where they're looking at hemoglobin and iron levels and things like that. An endoscopy or a colonoscopy are kind of the gold standards, or what they call a Cameron colonoscopy, where they'll put a little camera in your GI system and we'll see what everything looks like. And then let's talk about some of the treatments that are available from a natural perspective. So again, going back and identifying food sensitivities, you can do some specific food allergy tests where you look at antibodies against the foods that can tell us if your body's over-responding to those. And really, Crohn's disease is basically a overreaction of the GI system, the inflammatory or modulation response in the GI system. The immune system basically has a temper tantrum, and we have to figure out why the temper tantrum is there. So food specific diets and lifestyle modifications for them. I see a lot of problems with sugar and with caffeine, and then raw foods seems to be a real factor with a lot of people that have Crohn's disease. Now, from a treatment perspective, some of my favorite things to do for that is to skip the GI problem and heal people from the outside in. And what that means is we can skip the stomach problem, or we can skip the stomach process, which is inflamed anyway, and we put a nutritional IV therapy approach. And that means we take some vitamin C, some B5, B6, calcium, and my favorite mineral for Crohn's disease, which is zinc. And zinc really, really helps to heal up those little ulcerations that are through the layers of the GI system. But if you do it through the blood, what happens is you're not trying to push it through inflamed tissue. Another amazing treatment that's available for Crohn's disease is to do something called insufflation therapy. Now, insufflation therapy is an advanced, cutting-edge oxidative medical treatment where we actually get oxygen around those areas by taking a little bag of ozone and oxygen combination, a little tiny catheter, and we insert it in the rectum of the colon. You kind of push the bag forward, and it fills the area with healing oxygen. Now, there's a whole bunch of research on this approach, mainly through a wonderful doctor in Cuba named Silvia Menendez. There's a book on it called Ozone, the New Medical Drug. And there's lots of research. This is a safe approach. It's an easy approach, and I've seen really, really good outcomes with it. The other thing that's really important to do for Crohn's disease is to rewire the nervous system. Now, what does that mean? Now, if your body was a computer and you were having all these problems with your GI system, you were diagnosed with Crohn's disease, and we called up tech support would say, well, turn everything off and turn it back on. You want to reboot the system. And there's a specific German type of treatment called neural therapy where you can actually get the nerves associated with all the smooth muscle in the GI system to open, to close, and to reboot. And so you take a syringe with a little tiny needle, a specific type of B vitamin, some B12, and what you do is you bleb the skin over the GI system. The nerves that control the skin basically go to the organs, that go to the spinal cord, that go to the brain, and you can get those areas to reset. And as simple and possibly as weird as it sounds, I've seen miracles with doing neural therapy with people with chronic GI problems. You can see some of these miracles on our channel at Daily Dose of Vitamin H, and we talk about how many people with chronic health problems have stomach problems. From an oral perspective, what you want to do is you want to make sure that you have your fat-soluble vitamins, some Montmorillonite clay, some activated charcoal, some digestive enzymes to help the upper part of your GI, and then Rutin factor really helps to make the vitamin C process work better, the vitamin C pathways. It makes the vitamin C activate. It's really, really important for capillary fragility and capillary integrity. And what that means is that you have a tendency to bleed less if you have adequate Rutin factors. Now, the best natural source of Rutin is beet leaf greens, and what it does is it really helps vitamin C to work better. So this is Dr. West. We're doing a real quick summary on Crohn's disease. What is inflammatory bowel disease? It affects all layers of the GI system. It's a little bit different from ulcerative colitis. If you skip the stomach and do some vitamin infusion therapy with some insufflation therapy, and then support the food allergy pathways by identifying which foods are the allergen, and you can retrain the body by doing something called desensitization therapy. Again, a big mouthful. It's in one of our upcoming videos. Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.